This is News Center 5 at 6. Local live coverage you can count on.
I had something that was working. Why change it? So I'm shocked. Yes, I am.
Switching prescriptions. Team 5 investigates the cash incentives some doctors receive to make a change. Have you ever even thought about it? Have you wondered about a change in prescription from your doctor? Team 5 investigates discovered that some doctors are being paid by health insurers to switch patients to generic brands. And sometimes being paid in cash for each patient that they're switching. It's legal, but is it ethical if the patients don't know about it? News Center 5's Janet Wu is here with that story.
Ed, much of this controversy centers on the cholesterol-reducing drug Lipitor, the best-selling medicine in the world. Now, thousands of Massachusetts patients have recently discovered their insurer won't pay for it anymore, or that the out-of-pocket cost has skyrocketed. Still, other patients are being switched by their physicians with little explanation. But the biggest secret may be what the doctor stands to gain from the switch. Earlier this year, Blue Care Network in Michigan paid 2,400 doctors $2 million to switch their patients from Lipitor to a generic of its competitor, Zocor. They were paid $100 for each patient they switched from January 1st to March 31st.
Without saying to the patient, I have a financial incentive for making this decision that goes along with my professional incentives to do what's right for you, it's unethical. It's a clear conflict of interest.
Team 5 Investigates asked Blue Care Network of Michigan if patients were told of the financial kickback. A spokeswoman said not specifically. Here in Massachusetts, financial arrangements for switching patients off Lipitor is less blatant, but does exist. Partners Community Healthcare's medical director, Dr. Thomas Lee, told his colleagues earlier this year, physicians will be increasingly rewarded in our pay-for-performance contracts if we increase the percent of generics we use. Increasing our use of generic statins is therefore very much to our advantage.
Wow.
What's
I'm
your reaction?
shocked.
You are?
I am. That they're paying the doctors? Yes, I am. I'm shocked.
Holland said earlier this year her doctor switched her off Lipitor to a Zocor generic without explanation. And were you surprised when she took you off, or?
Yes, I was, because it had worked for me for so long. I also found that my cholesterol went up.
After you went on the statin?
Yes, after I went on the generic. So what happened is it got doubled, the milligrams.
But Hertzlinger said the medical efficacy is irrelevant to this debate.
You've got to tell the patient that I am switching you to a generic, not only because I think it's the best thing for you and it's going to save you money out of pocket, but because I'm going to make more money as a result of that.
Here in Massachusetts, financial arrangements vary according to the insurance plan. Some doctors get a cash bonus at the end of the year for various money-saving practices, including switching their patients to generics.
It really is upsetting to think that, they would get a kickback from using certain drugs.
Morrissey, who has taken several cholesterol-reducing medications over the past decade, had the best results with Lipitor, but she too was recently switched to a generic with little explanation. Doctors we spoke with, like Dr. Robert Frazier, said they've moved most people off Lipitor because patients save money. But he says he only gets a kickback for some of his patients, depending on their insurer. But if the doctor is also saving money and also making money off of that, don't you think it's their responsibility to tell the patient that they've got something financial stake?
Well, the problem is I don't know which patient I'm seeing at that moment. If you walk into my office and it's a patient, I don't know at that second whether you're an HMO patient or not.
As with the question over which drug is more effective, only your doctor can answer that question. But will he or she also answer the question, are they being rewarded for switching you? For Team 5 Investigates, I'm Janet Wu. Ed?